Hello everyone, welcome to this short video on understanding food sensitivities and intolerances. Have you ever wondered why you feel discomfort after some meals or bloated after eating certain foods? You may be experiencing a food sensitivity or intolerance, a common issue that affects up to 70% of the world's adult population. The most common food sensitivities are lactose intolerance and non-celiac gluten sensitivity. Lactose intolerance is due to a deficit in the enzyme lactase, which is needed to digest lactose found in milk and dairy products. Non-celiac gluten sensitivity is a negative reaction to gluten, a protein found primarily in wheat, barley, and rye. Let's delve into the common tests available for lactose intolerance. First, we have the hydrogen breath test that measures the high levels of hydrogen produced by undigested lactose. Next is a blood test that monitors the changes in blood glucose levels, indicating how well lactose is digested. For infants and children, a stool acidity test is frequently used. As for non-celiac gluten sensitivity tests, there are currently no universally accepted tests, although healthcare providers often recommend ruling out celiac disease and wheat allergy first. The industry of at-home food sensitivity testing is rapidly growing. These test kits involve sending a small blood sample to a lab for analysis. The lab then measures the body's IgG antibody response to various foods. However, many medical experts and organizations, including the American Academy of Allergy, Asthma, and AMP Immunology, question their scientific validity for diagnosing food sensitivities. Next, let us review this table of 9 categories of food sensitivities that you should be aware of. Lack of digestive enzymes, presence of certain chemicals, food additives, and possible existing underlying gastrointestinal issues are few of these issues which could lead to food sensitivities and intolerances. Let us also understand the difference between food allergies and food intolerances. Food allergies are immune system reactions and can be life-threatening in severe cases, requiring immediate medical attention. Food intolerances, on the other hand, are mentioned to generally involve less severe reactions and primarily affect the digestive system. Now let's delve into the quite talked about subject of chemicals in our food. It's almost impossible to avoid chemicals finding their way into our food in these present times. Certain chemicals in our food have the potential to instigate food sensitivity or intolerances over time. Let us review the table that lists 9 categories of chemicals that can possibly infiltrate our food. The list includes food preservatives, food flavorings, artificial sweeteners, food additives, and more. Understanding the role and effect of these chemicals reinforces the need to be informed and deliberate about our food choices. If you're experiencing food sensitivities, here are 6 suggestions to consider. Number 1 is the elimination diet. Try to identify and remove the foods that trigger symptoms. Number 2 is keeping a food diary to trace patterns and pinpoint problematic foods. This can help identify patterns and specific foods that may be causing issues. The remaining 4 suggestions include sipping on ginger tea, as ginger is known for its anti-inflammatory properties and may alleviate digestive discomfort. Staying well hydrated, which can assist in digestion. Adjusting cooking methods to reduce potential allergens, and managing stress levels, as stress can exacerbate food sensitivities. Practices such as yoga, meditation, and adequate sleep can help manage stress levels. However, always consult with a healthcare professional before starting any self-management or elimination diet, especially if symptoms are severe or persistent. In this last section, let us take a look at the emerging research and controversies in food sensitivities and intolerances. There is a lot of focus in the scientific community on use of probiotics and prebiotics to improve gut health and potentially reduce symptoms of food intolerances. Another area which has a lot of attention is personalized nutrition. This approach is believed to identify food sensitivities and intolerances better. As we conclude, it is essential to note that research into food sensitivities and intolerances is ongoing, with new findings and controversies emerging regularly. Always stay informed and remember, understanding your body's unique reactions to different foods is the first step towards a healthier, happier you. Thank you for watching. Your comments and suggestions are always greatly appreciated.